Have you been hearing people talk about something called mast cell activation syndrome? Hi, I'm Dr. Nick, and I'm an integrative doctor working out of Merge Health. I thought I'd spend a couple of minutes talking to you today about mast cells. Mast cells are a type of immune cell. They are a sentinel sensing cell that are resident in certain tissues of the body, trying to detect if the body is under threat of some sort, a threat from toxin, a threat from infection or viral infection, a threat from even kind of thermal or injury. Mast cells are thus very complex little sentinel police forces. They don't so much patrol just so much as are a smoke alarm on the ceiling, trying to see whether they should alarm off or if everything is okay, stable, at peace. Mast cells are known very much so in the medical community mainstream as the histamine releasing cell. And when we look at mast cell disorders, we think about hives, we think about runny nose, teary eyes, scratchy throats, all those histamine related conditions like eczema and asthma. But mast cells can release so much more than just the histamine inflammatory molecule. In fact, more than 1,000 molecules or cytokines, these immune molecules of inflammation cascade, have been known to be released by mast cells. And more than 200 receptors on the mast cells might trigger said release. I see a lot of people with a an unhappy smoke alarm system who have become overly sensitized to food, infection triggers, or toxins in our environments that is a dysregulated or brokenly releasing inflammatory cascade type system. Mast cell activation syndrome is diagnosed by having too much of these mediators that are released. Unfortunately, blood tests are pretty poor at capturing some of the main mediators that mast cells do release, though I do check for things like histamine and tryptase and chromogranin A as examples on a blood test of mast cells that are over releasing these inflammation markers. Um, Other ways we diagnose are actually through a patient's story. And if you have more than two systems involved of having an excessive inflammatory response from mast cell mediators, then that's on the criteria list for mast cell activation syndrome. So, what kind of symptoms does that look like? Well, if it's the mast cells in the brain, then mast cell mediated releases could look like headache. It could look like photosensitivity or light or sound sensitivity. It could be a head pressure sensation or ringing in the ears. I see a lot of neck stiffness and even insomnia as relation to mast cell activation of the brain. I see a lot of people with mast cells of the skin inflaming in the sense of rashes or hive eruptions or itchy, prickly sensations, even pins and needles in the skin. I see a lot of gut mast cells making people bloated or overly sensitive to so many food groups and then more food groups than ever they were used to reacting to. And those with mast cells in the bladder that are unhappy might have an overactive bladder urgency or overactive bladder syndrome. All of this can be really tested out though with a road test of treatment where we use agents that stabilize those receptors in the mast cell membrane, and a lot of these inflammatory symptoms simmer right down once we quieten down the smoke alarm blaring mast cell and say it's okay, we're not going to release the inflammatory messages today. This is another criteria of mast cell activation syndrome. If you respond to those mast cell stabilizing medicines that include histamine 1 receptor blockers, histamine 2 receptor blockers like famotidine, uh, mast cell stabilizing compounds like sodium cromyl glycate or ketotifen, and even natural bioflavonoid supplements like quercetin or luteolin. If I try two or three of these agents and symptoms really improve for people, this is almost a proof in the pudding that mast cell activation is a strong current of why you are so inflamed. If you are working with a practitioner experienced in environmental and integrative medicine like myself, we can go on from not only just making you less inflamed and thus having more energy with mast cell stabilizing, but then we can actually do some of the really wonderful upstream work of figuring out why the mast cells became so unhappy in you in the first instance. If you're interested in mast cell activation syndrome further, seek us out through an appointment at Merge Health. We'd love to catch up, educate further, and maybe even weigh in to calming down some of your inflammation in a more targeted way through mast cell activation related protocols. I'm Dr. Nick. We'll speak to you again soon. Thanks.